The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm your host, Dr. Joe Gambardella, with Advanced Physical Medicine and Rehab. You can find out more about us at our website, 8pmrmiami.com, or by calling the office 305-598-8788. I'm here today with Rob, our office manager. Hey, Rob.
How's it going, Doc?
Doing great. And I'm really happy to have with us today a good friend of mine, a good friend to the office, Rick Diaz. Rick, tell us a little bit about yourself. You're an attorney in Coral Gables.
Yes, well, good afternoon, Dr. Joe. Yes, I'm an attorney in Coral Gables. I've been practicing for 30 years. Before that, I had a partial law enforcement career with the Miami-Dade Police Department for 9 years. And I have an active practice. Myself and my wife, my primary area of practice is litigation against cigarette manufacturing companies.
And how do people find out more about you, Rick, or if they want to contact you or the practice?
They can contact our office at 305-444-7181. And they can also contact us at our email address, which is Rick, R-I-C-K, that's common spelling, at rjdpa.com.
Perfect. We've been friends for a long time, Rick.
We have.
I don't even want to count how many years.
Neither do I.
We actually met at the gym many, many years ago, back in our young days. But I think we look better now. You know, right?
I know I look better and I know I feel better, not because of myself, but because people have told me that, and unless they're all lying to me.
No,
I concur.
I've seen the old license picture. I didn't believe it when. Tell us, you know what? This is actually a great story, and I'm glad you're here to talk. We're going to talk about a couple of topics today about regenerative medicine, bioidentical hormone replacement therapy. But, you know, when we first met, I saw you in pretty good shape to begin with, and you said, Joe, you're not going to believe this, but you were how many pounds overweight?
Well, my weight at the time was just under 204, 205 pounds. But my body fat content was extremely high. Pre-diabetic, we're going back now to around 2011, 2012. Pre-diabetic, high cholesterol, high fat content, lethargic.
And this is not uncommon. This is pretty much what a lot of office people will feel. You start to get in your 40s, 50s. You're sitting at the computer, working at your desk, career-oriented, not having as much time to work out, and it's very common that this happens.
Right. And I was actually behind that curve in the sense that when we met, I was about 50 years old. So I was actually 10 years behind that curve. So I had been, like I said, I was in a condition, health-wise. I would say, it was critical. It was not good, but primarily it was because of just not being sufficiently active. But there's a lot more to it, as we'll talk about in a bit.
Yeah, and what got you on the track of getting back in shape? Was it actually seeing those lab results?
Well, right, exactly. So it started with my primary care physician, who I went to, was a new one, and he takes health and wellness very seriously, and he has an in-house nutritionist. And so when we got the first results, and they were really bad. And he talked about, diabetic, pre-diabetic and insulin around the corner and high blood pressure medication, heart medication, cholesterol medication. I said, whoa, it's time to rethink, my wellness. And like I said, at the time I was about 50 years old. So for many people, it's already too late. Fortunately for me, it was not.
Yep. So you started working out, you radically changed your diet?
It started with a very radical diet, somewhat similar to the Mediterranean diet and that kind of situation, but with the help of a nutritionist who happens to work with a lot of Miami Heat players. So I had very, very good nutritional advice. And then it started with getting back in the gym. That's how and where and why you and I met. And then there were additions to the overall wellness that you introduced me to that brought me to where I'm at today.
Yeah, so we want to let people know that when you want to start any type of medical weight loss program, when you want to get evaluated for low energy, low drive, poor recovery, nagging aches and pains, low libido, you have to do blood work. Most people don't even realize that.
So no, you're right. And of course, one of the things that we've done together, you and I, and even before I met you, with my primary care physician, my internist, was to do regular checkups. It's his program. Really, it's called Executive Health. His program actually does once a year, and with him we started twice a year, and I've stayed twice a year because I wanted to keep it tighter and keep myself more honest, quote unquote, if you want to call it that. So we do regular pulls, and sometimes I'll even do a blood pull before I go see him. Like maybe every 3 or 4 months, I'm drawing blood, either because of my annual or biannual visits with him, or because of my treatments with you.
So when we took a look at your blood work, a lot of the levels that you were concerned about, the high hemoglobin A1C, the high glucose, the high cholesterol, those had leveled out pretty well.
They had.
And we looked a little bit further now about taking it to the next level, getting you that more energy that you were looking for, better recovery. And we started to look at some of these key anti-inflammatory hormones, these hormones that affect recovery, such as testosterone, growth hormone, estrogen, your vitamin levels, B12, vitamin D. And we found out that although you were quote unquote normal, you definitely weren't optimal.
Right. I guess the best way to describe it in my world, in my mind, was when we met, based on my few years prior, I was doing good, but now I'm doing great.
Yeah, so what I mean by that, normal and optimal, is simply this. Just because you fall into a range, let's say when evaluating testosterone, it's such a huge range. It's not a 10-point range of normal to abnormal. The acceptable range for testosterone in males ranges from anywhere from 258 to 1197. I mean, it's hundreds of points of a variation, where if you fit in anywhere on that scale at any age, you're considered by most medical professionals to be normal.
Right.
So as a 55-year-old who tests out at, let's just say, 300, you're quote unquote, again, in the normal range, but a 300 is not going to give you anything that you're looking for in terms of changing your body, gaining muscle, losing fat, better recovery, deeper sleep. But a level of 700, 900 or better will. And so when we did the initial evaluation, maybe surprising to some out there, not surprising to me anymore because I've seen it so many times, you were in a range that, let's just say, was 350 or 400. And it kind of matched how you were feeling.
Right. Right.
And we explained to you about our program, which is how do you bring these levels back up safely and effectively, really getting your own body to do the work for us. And we introduced you to our bioidentical hormone replacement therapy program, which, to explain to the audience, it is a way to bring up your testosterone levels, get your body to produce more testosterone, control estrogen and lower stress hormones all at the same time.
Right. And one of the things that amazed me when we had those discussions was that I had never used but being in the gym, I had heard and seen people who were using these types, primarily the testosterone supplement, and to my amaze, were not complementing it with all of the anti-reactive additions of supplements. And those are the people who really need to be very careful, because it's not just a question of testosterone enhancement. That can actually be very dangerous and adverse if you don't do it under the care of a physician who knows what he's doing or she's doing, and with all of these other counteractive medications that we've been talking about.
I think you bring up a huge point in that there is a huge difference between TRT, which is testosterone replacement therapy, and bioidentical hormone replacement therapy. For all who taken testosterone for a long time and not taking it with Arimidex or not taking it with HCG, they're cutting themselves short. Isn't that right, Doc?
Absolutely, because as we age, certain hormones that are essential decrease in our body, others that we need to control the amount of that hormone in our blood increase. So you have to monitor all of these. As some go up, some go down. And if you just take, let's just say, testosterone over time, your red blood cells are going to thicken. So the chances of potentially developing high blood pressure are there. The chances of developing secondary kidney problems are there because you're pushing more volume through the body. But again, testosterone is something that is essential. It's normal in the body, and you have to have it in sufficient levels to be able to recover and have the drive that you need. So when you monitor this, you can make sure that you are sufficient in terms of where the testosterone is, that your hemoglobin levels are completely normal. You mentioned that HCG is a key component of the program because HCG mimics luteinizing hormone. It's a hormone that's found in your body that stimulates your body to keep making testosterone. So, Rick, if for any reason you had to travel, you weren't able to take testosterone, your body's still going to keep making it.
Right.
It's just not going to make the essential amounts that you need, but you're still making your own. People who only take testosterone completely and totally shut their body down in the way that they can make testosterone. And if you shut it down long enough, it's not going to make sufficient amounts, even if you have to stop.
Right. I've learned that from you, but I've also read that independently, and that's one of the things that concerns me about people who I know and I've met who supplement testosterone, but they don't have any of the other, like I said, complementary components. And I think, I read about it could be life-threatening or certainly have adverse, long-term adverse effects that far outweigh the benefits, the short-term benefits of the testosterone increment.
Yeah, it's something that really needs to be addressed. I mention it always on these shows, is that the leading cause of death in the United States is heart disease and cancer, always 1 and 2. And those are caused primarily because of a variety of different factors, but amongst those are essential hormones in your body that control inflammation decrease over time. So if you don't have enough testosterone, the risks of developing chronic disease are significantly higher. At the same time, if you have too much of a good thing, you have risks there. So you want to be someplace in the middle. And being able to be a patient to do this and get all the benefits without any side effects has to make you feel at least comfortable.
Yeah, and I think one of the things, I think we talked a little bit about it, is the most important thing. If you're going to do this, do it legally, because a lot of the black market stuff is questionable, and of course it's illegal. And you have to do it with not just any physician, but a known physician such as yourself. And even if you have somebody like yourself governing a patient's wellness program, you have to monitor it constantly. You have to be checking your hemoglobin. Because of the medications you're taking, you have to do the periodic blood pulls. And one of the things that impresses me the most about your office is how well they work with you. You calendar things as a patient, but you forget things, you travel, and your office is very good at nagging me, and I presume all the other patients, of making sure that they come in. And they're on you, and they will not renew a prescription unless they know that you're in full compliance with their protocol. So I think that's really important too. You can have everything going right doctor, right prescriptions, but if you're not taking them the right way and you're not monitoring yourself and have the benefit of the staff that your office gives you in that external monitoring, things can go wrong. So I think it's really important to stay on the track.
Because life happens. You're a busy person. I'm sure it's hard to keep up with this regimen. That can be a little demanding at times. But if you have someone in your corner like us constantly nagging you or reminding you and making sure that you're staying on top, because at the end of the day, it is your health. And to us, that's the most important thing for us to take care of. You're trusting us with your health, so we want to make sure that we do everything we possibly can, that you do the program correct.
Well, and that's what I think is really important, because it's easy for any physician to say, you know what, I gave the prescription to the patient, but how often do you go to the doctor and they'll give you a prescription and they don't even verify that you filled it at the pharmacy? And if they do that much, which is probably rare to ever, they don't call you to say, did you take the medication? So one of the things that I really enjoy about your staff is that, you get the first email before it's supposed to come in about, your drug, your blood draw, and your new package or order or fulfillment. And then if you don't respond, the next one comes in within a few days, maybe a week. It's a little harsher in tone. Yeah. It's still nice, but you let everybody know. And it's a good thing, because some people need to be prodded or reminded more than others. And I think that you go above and beyond what a physician has to do to make sure that their patients are in compliance, particularly when we're talking about these kinds of supplements that, they're very good, but they have to be properly monitored.
So how do you feel, Rick? When I walk into the gym and I see you're in amazing shape, people say that all the time. When I ask them if they know you, they always make reference to the guy in really good shape. How do you feel?
Well, I'm very proud. It has not been easy, but earlier I said I used to feel good, and after I started with you, I feel great. It's amazing how many people come up to me in the gym, and when they find out my true age, they fall back, or they haven't seen me in 10 years, and they go, "You look younger now than I saw you 10 years ago," literally. I still
has to feel good, huh?
Oh, it feels great. I still have my driver's license, which I showed our assistant here, and it's from 10 years ago. When I fly a lot. When I fly in TSA, they stop and they look at the 10-year-old driver's license versus the face that they see today. Yeah. So you feel stronger, you feel better, you feel more energetic. But it's just a good feeling. Everybody likes to look good, everybody likes to feel good, and everybody likes to get feedback. But when you get feedback so often from so many people, you're doing something right. It's not just you looking at yourself in the mirror.
Yep. And I know you like to do everything. If you're going to do it, you're going to do it the right way. You have access to all these different types of therapies and treatments. And just knowing you over the years, whether it's a restaurant, a bottle of wine, you're going to do the best. And especially when it comes to yourself. There's a lot of places where we can skimp and save money, but when it comes to our health, it's our greatest possession. So you're really going to want to make all the investment necessary to make sure that you have a long, healthy life.
Yeah, when I look at the cost of the program, it's ridiculous. It pales in comparison to the kind of money that people spend on things that are not good for them. So to me, it's not even a question. If you're really serious about your health, the cost is not even something to consider. And you can certainly, if you're really on a tight budget, there are so many things that we all do that we can sacrifice a little here and there to be able to afford wellness. You can't You can purchase another bottle of wine tomorrow or a different bottle of beer the next day, but you can't buy youth. You can't buy rejuvenation. You got to invest in it. So it's just a question of really wanting to have it done. And it's not unaffordable.
So we're going to be back right after the break talking more to Rick and about some of the other things we've been able to help him with.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
So we're back with Rick. And Rick, we were just talking about how you've been feeling better at the gym and, time has passed, looking good, feeling good. And then one day you came up to me and you were talking to me about your neck and how it had been bothering you. And I had been talking to you over the years about some of the new products and services that we were offering at the office, how we had gotten heavily into regenerative medicine and stem cell therapy. And I remember getting a text from you one day about, hey, can I come in and maybe get my neck evaluated to see if this thing might be able to help me? So tell me about that.
Right. So actually, you may not remember this part of it, but it was kind of like the intro to what you just mentioned. And that is one day I was in the gym and I was having, and when I go to the gym, I'm full on, or I don't go. And I just had a really bad headache, and it stemmed from the back. And you looked at me and I said, "Are you sure we're going to do this here? We're not we're not at your office." But you were kind enough to take the interest and the time, and we had just chatted and met a couple of times. We weren't as close friends as we have become over the years since then. But you actually adjusted me in the gym on one of their chairs and tables. And you remember you telling me, I'll never forget this, you said, "You're going to sleep like a baby tonight." I said, "How is it possible you're going to sleep like a baby after a guy just cracks your neck? That's crazy." Well, I did sleep like a baby, and it was that correction that you did that caused me to send that text to you later on, which ultimately led us to become doctor-patient besides friends. And so, but that was a result of a car accident, a rear-end collision that I had. I was at a full stop, and I got hit by another vehicle at about 40 miles an hour. It was pretty violent. And I was never the same after that. It was chronic pain, Advils, 5 or 6 times a week. MRIs, X-rays, yes, doctors, the best, neurologists, orthos. We need to do this, spinal surgery, this, fusions, and it freaked me out.
Did you try any actual therapies, physical therapy?
Yes, I actually
did.
I did about 3 months of physical therapy following the accident, and it would help, but it was an Aleve that lasted at most 3 days. When I got out of there, I felt pretty good. Not great, but pretty good. But it waned off after a couple of days. And so you'd be supplementing with Advil, which is horrible for your liver. And then I tried acupuncture for a long period of time, and that was maybe even less of a relief in terms of duration than the physical therapy. Physical therapy ran out from an insurance perspective, and it can be very expensive at $150, $175 for an hour, 3 or 4 times a week. So I gave up on all of that. I tried massage therapy. That helped, but again, it was short-term relief. And then finally you came up when I met you and suggested that I come and get adjusted with you on a more periodic basis, and that's when we discussed, which I'm assuming we're going to talk about a little bit more now, which was the real holy grail for me, which was stem cells.
Yeah, I remember you had an episode. You came into the office, and I did a little bit of therapy on you, adjusted you. We did some decompression therapy to alleviate, pull some of the pressure off the nerve. But you had told me you had recently done an MRI, and we waited for those results to come in. And when we got the results back in, the results were significant. I mean, multiple levels of disc herniations, moderate to severe stenosis, arthritis, and you had expressed to me that desire, if there was any way to fix this without surgery, you wanted to know about it. And that's when we started to talk about a regenerative medicine and stem cell program.
Right. I was on the brink. I was actually, I was a phone call away from scheduling the back surgery, and I said, I got to try one last thing, and that's when I came to you.
And just to let everyone know out there, there's some things that are necessary for healing. There's really 4 things that are necessary for healing. Number 1 is inflammation, and you had plenty of it. I mean, you had the pain, you had the achiness, you had the chronic discomfort that was not going away. It was there for more than 3 months, which by definition, if you have pain for longer than 3 months at a time, it is a chronic condition. Chronic conditions are degenerative and do not get better with time. And the next thing you have to have is you have to have oxygen present in order for healing to occur. You have to have enough stem cells in your body, and those stem cells have to be strong enough to release enough of the compounds that your body will then use to heal. So if we take that step by step, the fact that you had this chronic inflammation told us that your own stem cells that were existing in your body were not strong enough, or you didn't have enough of them to help this injury heal completely. And it let us know that where the injury occurred, the structure was considered avascular. Discs, meniscus, labrums, those tissues in the body that provide cushion and support don't have a blood supply. So because there's no blood carrying oxygen, the location of that injury made it near impossible to heal. As time passes, less oxygen is available and less stem cells are available. So we basically unpackaged that and said, look, this is an injury to the discs of the neck. First thing that we have to do is get more oxygen into that area. So we use something called prolozone therapy, which is taking medical grade oxygen, running it through an ozone generator and coming up with something called ozone, combine it with a bunch of different amino acids, dextrose, saline, trace minerals, and we put that into the interspinous space and followed it by a biologic allograft that contains stem cells. And what that did was, if you follow the track of healing, the inflammation that you had started to reduce almost immediately, right? How did you feel? I remember getting a text from you a day or two later that you said, I can't believe it, but I mean, I don't think I felt this good in.
Oh, yeah.
And you were just kind of waiting for the other shoe to drop to say, well, maybe this is only temporary.
Right.
But tell me about that.
No, you're exactly right. It was within maybe 2 days, 3 days later. It was, the only word I can use to describe it is, some people who are very Catholic or religious may say, well, how could he say that? But it truly was miraculous. I mean, it's just, I don't have any other word for it to describe it. It was life-changing, it was miraculous. It was, but I was afraid. I said, this is just going to be like, the acupuncture. It's going to be like the physical therapy. This is going to be like, the shot in the back. It's going to go away. It's just, it cannot last forever, or it cannot last long enough. And it's not it's not an inexpensive procedure. But again, you put the number aside in terms of the expense if you want to look good and feel good. So that wasn't the issue. And one of the things I want to mention is you talked about the condition that I had as you diagnosed it. For a lot of people listening, they're probably saying, "Whoa, they may be dizzy." What is he talking about? Prolo and this and that. I think what's important, and what was important for me, even as a lawyer, I can listen to all of this, but it can still be very confusing. What I really enjoyed with you and your folks was that you took the time to put those explanations in words that people can understand. And I thought that was very important because a lot of people go to the doctor and they listen and they walk out, and then the husband or wife says, "What did he tell you?" And you don't know what.
Yeah.
You sit there at the time and you nod your head with the doctor and you just say, "Well, just when do I have to see you next? What pill do I have to take?" And they don't process it. And so what I really enjoyed about the pre intervention procedure was that you took the time to show me the X-ray, to show me the MRI, to explain things slowly, understandably. Like I said, the fact that I'm a lawyer doesn't matter. I still need to understand the implications of the medical problem and the possible or the expectation of the results. Yes. And then, here we are. It's probably been almost a year now, maybe a little bit less. And the condition is the same. I mean, I feel great. And it's hard to explain. I've told a lot of people about it. Who are complaining about injury similar to mine, and it's just like nothing I ever imagined. And
the couple of key takeaways are, if you have a condition like this, don't wait. When people come into our office for an evaluation, we don't charge them for that. The reason we don't charge them is because we don't know if we can help them, and I don't think it's fair. If you're going to be making an investment like that, you said, it's something that everyone can afford, but it is an investment that is oftentimes necessary. But we have to make sure that we can help you first, and we always let our patients know if we can help you, we will. If we can't, we let you know that too. And the second thing is you mentioned it's almost a year later. We have patients we've done this procedure on 3, 4, 5 years ago, and they're still doing great. They're actually doing better. People often ask, well, how long does it last? And the answer is it lasts as long as you last. If you cut your arm and it heals, how long is that going to last? It's going to last until you cut it again. So if you're doing what you're doing, you're keeping your hormones balanced, keeping your vitamins balanced, you live a great life, you take care of yourself with a great diet, things are just going to get better and better. Over the break, we were just talking about longevity with Wanda. And, she was saying people who are 40 today are probably going to live to be 100, 110 years old. And the ones that are younger are going to go even longer. But it's quality and function that matter. You don't want to be 100 years old with no pain, but you can't walk. And you don't want to be 80 years old with lots of pain and having to take drugs to move around. That's going to shorten your lifespan. So you got to find
that's what we
happy medium.
Keep coming back to it. I mean, you're investing in your longevity. I mean, all you got to do is look at the Sundays, the obituaries, and people who, when we were kids, were dying at 50 and 60. We now see the obituaries 90 and 100.
Yeah.
And so if you're doing the wellness program on top of that, your expectations could and should be higher.
Rick, I just want to say it's been a great pleasure of mine having you in here today, having you as a friend. I want people to know, again, if they are looking for an attorney, a specific type of an attorney, especially that deals with litigation, how do they get in touch with you again?
305-444-7181. And just like you, we don't charge for any consultation or evaluation of the case.
Stay tuned for future episodes. Join me every Wednesday night at 6 p.m. and Sunday morning at 9:30 to learn more about stem cells, bioidentical hormones, and physical medicine. Visit us at our webpage, apmrmiami.com, and call for your free consultation at 305-598-8788. I'm your healthy host, Dr. Joe Gambardella, and I'll see you next time.